Life Unrehearsed, brought to you by Lianas Senior Transition Support, specialists in downsizing and seniors residences.
Welcome back to Life Unrehearsed on this delightful Saturday afternoon. My name is Matt Delvecchio, specializing in life transitions, downsizing in the senior living industry.
And my name is Corey Sirota, clinical social worker and author of Someone Died, Now What?
You know, Corey, it's early December 4th, and people are starting to organize their parties. Are we allowed 10? Are we allowed 25? I think a lot of people are still going to err on the lower number. I know we will be at home, but there's a lot of organizing going on, including yourself. Don't you have something for Myra's Foundation going on?
That's right. We have our annual holiday party for the campers and families, because we recognize that grieving is all year long, especially around the holidays. It can be very difficult. So we're having our holiday party with all the vaccinated people checking their vaccination QR codes, but they're coming in and we're going to be celebrating then. So I'm looking forward to that.
Yeah, good.
In the meantime, let's welcome everybody back to Life Unrehearsed and our segment called Helping Moms and Dads. What we're doing is we're providing guidance and support to the sandwich generation. Interesting, knowledgeable guests are covering a vast array of topics, and we're hoping to help families cope with the challenges of aging and the aging process.
Yeah, we've really had a lot of good feedback on this Helping Moms and Dads segment, because it touches a lot of people and multiple generations. And so what do we've got this week, Corey?
Well, it's my pleasure to introduce you. We're going to be talking about how to navigate our healthcare system, because honestly, if anybody's tried to navigate it, you know very well that it can be challenging. And if you haven't, maybe you've been hesitant to do so because of that. So when it comes to accessing services, particularly from the CLSC, there's information that we want to share with you that you really do need to know. Matt, this is your line of work. You do this all the time. I know that it's a challenge for families. Would you say that that's a fair statement?
Yeah, it really is. And I just want to clarify, I don't actually work for the CLC, but I'm in my world of helping seniors and transitions. I'm on the phone with our healthcare services all the time. So we thought it would be a good idea to share some of the helpful words of advice that we've learned over the years. And so, yes, it is difficult to get services. And probably what exasperates it even more is that when you need the services, emotions are high, anxiety levels are high, because you need some services for a loved one. And that adds to everything. Now, I just want to stress, though, that let's acknowledge that our healthcare system needs a lot of work, okay? And we hear it all the time. There's a ton of negativity. So let's just put it right out there. Yes, we do know that we could do a lot better. But I also want to just stress that the vast majority of the employees, the workers that are in the system, whether it's CLSC social workers or the nurses or the social workers at hospitals, the majority of them are doing their very best under the resources that they are given. And so we want to give a shout out to them. And we've had many people come to us and saying, you know what, the system is maybe even broken, but we've been happy with some of the CLSC services that we're getting. So we want to change the narrative around a bit for at least the next segments and not be so negative, a little bit of the holiday spirit. And so we want to encourage anyone who actually has had a good experience with the CLSC. We want you to text in at 514-800. We want to hear from you while we start giving out some words of advice.
So Matt, services, we've mentioned it a lot. Can you tell us more specifically what types of services for seniors are accessed from the CLSC?
Yeah, I'll be real quick, but in general, a very popular one is home care services, they would refer to as assistance with the activities of daily living. There's also post-hospitalization support. You know, if there was an operation and you had to go back home, well, the CLSC can help with some rehab or even bandage replacements. There's home adaptation programs where someone can come in, do an assessment. Are there risk factors involved, for example, in the washroom or the kitchen? You may even even need, for example, a hospital bed. Transferring out of bed is just no longer possible. Mobility is extremely limited. CLSC can help with bringing in even hospital beds. They also do a lot if it gets to a point where living at home is too much. They help with the process of getting a loved one into a public residence, CHSLD, and they do respite care, blood tests, and it's surprisingly a lot of services offered by the CLSC.
That's the voice of Matt Del Vecchio. He's here with me, Corey Sirota. We're talking about how to efficiently navigate our healthcare system. We want to hear from you. What are some of the positive experiences you've had? Text us 514-800 or phone in at 514-790-0800, and love to hear what your experience has been. Now, you've talked about some very important services that are offered. If I think I need it, my loved one needs it, my parents need it, how do I go about getting these services?
All right, so the services are managed by the CLSC, your local CLSC. So there are different CLSCs. By the way, it's a Centre Local de Services Communautaires. It's basically your local community service. And you would call your local CLSC and you would explain your situation. If you even get to the main reception, that is still fine. And try to get a case manager assigned to you. And what you want to do is you want to be specific with some of the details. For example, mom's living on her own and she's not getting much family support. We live at a town or we're busy professionals. She fell recently or she's not taking her medications. Hygiene is an issue. She had a urinary tract infection 2 weeks ago. There might be mobility issues or even cognitive issues. So spell it out to them, and then eventually a case manager will be assigned to you. It's not going to happen overnight. It takes some time, but you really got to advocate and be as specific as possible.
I just want to mention that we did get a text in. I've always had wonderful service from my CLSC Metro on de Maisonneuve Boulevard, Mavis. Thanks, Mavis, for letting us know. I appreciate the shout out to the CLSC. So let's expand on home care services. I know they're in high demand from the public. Can you provide us with some examples of the type of home care help the CLSC can offer?
Yeah, they can do quite a bit. Someone can come in. There might be problems with medication management, particularly those that might be having some issues with dementia or Alzheimer's, and they're not taking their meds on time or in the wrong quantities. Physical reasons, mobility, transferring out of bed might be an issue, and people can help with that in the morning or in the evening, help with dressing and undressing. Bathing and hygiene is very important. We talked about urinary tract infection. UTIs are usually a result of lack of proper hygiene, so they could help with bathing. You may have catheters that need to be cleaned and replaced. They could do injections and respite care.
Along with that, I wanted to ask also, I know that with all kinds of services, the reality is resources are very limited. So what would you suggest? What can be done if someone feels they need more help at home, even more than what they're presently being provided?
Yeah, Corey, I hear this a lot. Let's assume you already have a file opened up with the CLSC. But care requirements are going to change over time. Your care might get better. You might be improving. Great. In all likelihood, as we age, we're going to require more care. So you need to let the CLSC know about not only the care requirements of your loved ones, but also for you, the caregiver, whether it's a spouse, a son, or a daughter. Now people are going back to the office more and more. You're not around as much. So you want to be able to explain that the situation has changed, say, from 6 months ago when they first open up the file, because it will, and be specific. What has changed? Take some notes, and so you write it down, and when you're on the phone, you put it in writing, and just be prepared when you're going to talk to that CLSC worker.
Sound advice. Oh, we have to head out to traffic, but when we come back, I want to know about how to access, how to tackle some of the support services from the CLSC when the individual refuses to accept it. Right now, we're going to hear quickly. Always a challenge. We're going to head out to the CJD Traffic Center with Jill Fitzgerald.
Life Unrehearsed, brought to you by Lianas Senior Transition Support, specialists in downsizing and seniors residences.
Welcome back. You're listening to Life Unrehearsed. I'm Corey Sirota along with Matt Del Vecchio, and we are providing some helpful hints on how to access healthcare services through the CLSC. Matt, I want to know really It's great as all these services are. Sometimes you get pushback from people. What do I need it? Why I'm good. We're mobile. It's okay. And so, please help me. What kind of advice or suggestions would you give somebody who has either parents or partner who's giving pushback?
Yeah, it's amazing, and we hear that a lot. And whether it's they feel they're okay or they're just not comfortable with having someone from outside come into the home, and it's a little frustrating because one, it's difficult to get services, and you may get to a point where you've got some services ready to go, and mom or dad or both parents saying no, we don't want. So I think the best approach, and let me start with what you shouldn't do. Don't patronize your parents. Don't tell them what to do. We didn't like being told what to do as teenagers, and many times we rebelled. It's the same thing, but in reverse. So I believe that the best approach, and I see this quite often, is to make your parents truly understand how it is affecting you, the caregiver, the spouse, the daughter, the son. Make them clearly understand the situation. So, for example, maybe you're working. Maybe you have to go back to the office a little bit more. You have your own family to deal with. Typical sandwich generation issues. You're trying to take care of mom and dad, doing what you can, running out there, and you've got your own kids to worry about, and they've got their dress rehearsals and the hockey. And you could even play the card of and I hear this because it's true, the relationship with your own spouse. Your marriage may be on the rocks just because you are so stressed and anxiety, so look, I'm having real trouble with my husband. Now, by the way, you only want to play that card if your parents actually like your husband. Okay?
Fair.
You don't want
fair.
that scenario that, God, I wanted you to get rid of him a long time ago,
Yeah.
right? But explain your own health and well-being is being affected. You have to sometimes show some tough love. You're always running for them, and sometimes you might actually have to say no to them.
Well, those are all, I think, very reasonable and respectful
Right.
suggestions. So I hope people that are listening out there are writing them down and hearing them well. Speaking of people out there, we did get some texts. We actually got a shout out to the CLSC St. Louis. The texter says, my case manager has been very helpful in getting us access some home care services. She's sometimes difficult to get a hold of. Okay, fair. But she is compassionate, and I can see that she's working hard to support my parents. Well, lovely. Thank you so much for that
Yeah,
text.
very nice. We got another one too here, Corey. I am now getting 20 hours a week through Chèque Emploi, and I get to hire my own caregiver. So it's interesting. Let me expand on that. A lot of people don't know that exists, but we talked about home care services that are provided. Now, simply because there is a lack of staffing and employees, there's something called Chèque Emploi, where you could actually hire your own caregivers. So in this case, this particular caregiver is getting 20 hours a week. They're paying I think the rate now is about $17 an hour that the government will pay 20 hours a week at $17 an hour, and you get to hire your own caregiver. So that has really helped, with the system. It's not bogged down as much. So yeah, thank you for that text. It was we're starting to see that a little bit more.
So, when we also reach the point where someone is perhaps no longer able to stay at home, what would you help us understand what the process of getting a loved one into a public long-term care home like a CHSLD
Yeah,
is?
and that's what a CHSLD is. It's basically a nursing home in the public system. And so, yeah, if it gets to a point where it's simply becoming too much at home and there is the individual, your loved one is at high risk, it just can't do it at home anymore, then you, as a Quebec taxpayer, has the right to make an application to get into a public residence. So what you need to do is you need to get an evaluation through the CLSC. Again, easier said than done. It does take some time, but that's what they do. They'll come in, someone will come in and do an evaluation. There's actually a grading system. It's called a SMAF, SMAF, and you'll get a score, and that will determine the priority level of getting into a public residence. They'll ask you, where do you want to go? Which public residence? You get to choose one. And then the process gets started. Now, I'm making it sound nice and simple. It isn't, because it does take time, and there are unfortunately long waiting lists. Some several months, but usually year and a half, 2 years to get into a public residence. And that's where it gets a little bit gray zone, because what would happen is you might go into a transition bed. You don't have a choice of that transition bed. There's a triage system. You might get some more access to home care services at home as well.
So that really feeds into actually another text. Someone wrote in and said, we finally got someone in to do an evaluation for my dad to get him into a public CHSLD. They were understanding and explained all of our options. He's now on a waiting list for a permanent bed at Bayview. Just not sure about a transition bed, kind of concerned.
Yeah,
Can you explain the transition bed concept?
Yeah, I get that a lot. And Bayview is a great public CHSLD out in the West Island. And what happens is during that waiting period, because there is a long waiting list, you need to go to a transition bed. And so some families get concerned because that transition bed could be anywhere. It's a triage system done by the government, and there's a whole formal system in place. Not even your case manager can tell you where that transition bed's going to be. They try to put it in the same geography. So what a lot of families do, actually, you have the right to go private if you want during that waiting period. And so that is also quite popular. If it has to be for 6 months or for a year and a half, at least you're able to choose a residence nearby you. Of course, it's more expensive to go private, but some families are going that option as well.
That's the voice of Matt Del Vecchio. We're talking about how to efficiently navigate our healthcare system. We also want to hear from you. You can text us in at 514-800 or phone 514-790-0800. If you have a positive experience at the CLSC, we'd love to hear about it. You mentioned the long-term care. So obviously the private long-term care homes are an option?
Yeah, there are private long-term. We're fortunate in Quebec. I also operate in Ontario, and you must go through the public system. So yes, you do have a private option for long-term care home. We got a couple more texts, Corey. I'll read one of them here. The CLSC Benny Farm. There's a shout out to them. They've been very helpful for my mom. They come in daily to help with her medication, and they give her a bath once per week. And so it doesn't seem like much, but that medication management is absolutely huge. You don't want to forget your medications, or even worse, take double or triple doses. So the CLSC Benny Farm, shout out to you guys there.
And the shout out to the CLSC Champlain Charles Lemoyne. Very caring and giving. Thank you for that as well. Matt, we're running out of time. We got to go. Any little, most important piece of advice that you would want to give someone who's trying to navigate this system?
Well, I would say don't give up. You really do have to advocate, and the squeaky wheel gets the grease, unfortunately. So don't give up. The services are there. You're just going to have to make a couple extra phone calls and know that the services are there. Well, Corey, thank you for asking.
Thank you.
Questions.
Thank you, Matt. How can our listeners get a hold of you?
Yeah, very quickly. Lianas Senior Transition Support. And I think that the best way is just look up the website, Lianas Senior Transition Support. And thank you, Corey. Corey, what do we have coming up next week on Life Unrehearsed?
Being proactive with colorectal health, as we talk to a colon cancer survivor, and not someone whom you would imagine it would be. We're talking to a woman in her 30s whose journey with colon cancer is both inspiring and courageous. And if you're at risk for slips and falls in your own home, you may not know it. So we're going to have a